All right, so I'm back and I'm going to briefly just talk about diabetes. So I believe I was officially diagnosed with diabetes about a year or two ago. Um I've been on several medications, but most recently the main one has been Jardiance. I started with a low dose and I think now I am taking 25 milligrams, I believe. And I also was taking a glycipitide or something. I will put it on the screen. I'll put it on the screen, I promise. um, but prior to that, I was pre-diabetic for over a decade. That's something my doctor, my PCP, has looked at over the years, and I actually switched PCPs because my previous PCP, it was a training facility, so I always saw a different doctor. And whenever I would come in the office, they were always offering me weight loss pills. They was like, "Hey, if you lose a couple pounds, we'll put you on these weight loss pills." They were kind of just looking at my weight and not the whole picture. It wasn't until I went to my gynecologist where I was we dove deeper into my health. But the diabetes, something I kind of teetered with for over a decade, and then most recently within the past couple years, I was officially diagnosed with diabetes. And my doctor, my current PCP, they recommend me taking an injectable to help aid my diabetes right off the bat. But it's something that we worked on for the past couple years, and I couldn't do it myself, or I didn't try hard enough to do it with just eating better, as well as the medication that I was currently on, which was most recently Jardiance. So it's something I kind of went back and forth with, and this most recently I was comfortable enough to try something new, and that's why I am now taking Mounjaro. So that's a brief history of my diabetes. Not too much to go into depth with. That's pretty much sums it up. So that is the number one reason why I am taking Mounjaro to combat my diabetes.